Without further delay, I have this great pleasure and honor of introducing you to Rear Admiral Gillingham. He's a native of San Diego. He earned his Bachelor's of Arts in Cultural Anthropology from UC San Diego and a Doctor of Medicine from the Uniformed Services University of the Health Sciences. His medical specialty is as a pediatric orthopedic surgeon, and he's currently serving as the Surgeon General of the U.S. Navy as a capstone to a very distinguished career in Navy medicine all around the world. He has served as a diving medical officer in the Caribbean, aboard the U.S. Navy hospital ship USNS Mercy, as an pediatric orthopedic surgeon in San, as a commanding officer of several military hospitals, and as officer in charge of the surgical shock trauma platoon caring for Marines in the Second Battle of Fallujah in Iraq. He also served as the joint U.S. military surgeon for the aftermath of the Fukushima nuclear disaster in Japan 2011. General Gillingham has a few slides to share with us today. And as I said, we're going to learn a lot more about military response to COVID and a lot more about Navy medicine. So thank you very much for being with us today.
Oh, Jackie, it's truly my pleasure, and so thank you for this opportunity. One of my goals, we'll certainly talk about how we've dealt with COVID in the United States Navy, but one of my goals is to share the breadth of what we do in Navy medicine, because frankly, I think almost no matter what specialty you go into in medicine, there's an opportunity in the Navy. Also would just emphasize that we have the privilege of carrying, being the medical force for the Marine Corps as well. So both Navy and Marine Corps have Navy medical personnel assigned to them. And I realize in the group there are those who are interested in dentistry and veterinary medicine as well. We have a very active dental corps, as you'll see. The veterinary corps is actually a job that the Army handles. So even on Navy bases, the veterinarians are Army. So just for folks, and as much as it hates me, as much as I hate to build up the Army, I will say that they've got a phenomenal veterinary program that's worth looking into if someone is pursuing that field. So with that, I think we'll go ahead and start, just quickly go through the presentation. And so we're doing the screen manipulation here to bring it up. Okay, well, very good. So as I said, we'll talk about Navy medicine's COVID response, but I want to use that as a springboard to just kind of explain what Navy medicine does, and I hope enlarge your understanding of the breadth of what we do, because I would imagine from the outside looking in, you probably think of us primarily as just serving aboard ships, but I will tell you that it's much broader than that. When I had the privilege of being selected as the 39th Surgeon General, I'll say with pride, I'm I think to my knowledge, the first orthopedic surgeon to ever been the Surgeon General. But more importantly, I have the distinct privilege and honor of representing almost 65,000 individuals, about a third of those in uniform. And so as I came in, I wanted to provide clear guidance to the team as to what our priorities should be. You'll see the bumper sticker there, our motto, Navy Medicine, Medical Power for Naval Superiority. And that's what makes us different. That's what sets us apart from, say, all of the physicians, nurses, and medical technicians at the University of Pennsylvania. We have a very specific mission, and that's to ensure that those who defend our country, both on the sea and on our shores, the Marine Corps, that they are as ready to go. We obviously prefer that we never have to be in a conflict, but even day to day, we keep our Marines and sailors as healthy as they can be and able to perform to their limit. And so that's naval superiority. And so you may not think of medical as medical power, but in fact, as I think I'm going to convince you, you'll see one example of how we've projected medical power during the COVID response. But my 4 priorities are listed there. People, our foundation is highly motivated, highly trained people, and as you'll see, that crosses a wide variety of medical specialties, non-medical specialties, dentistry, as I said, and other areas. We perform our duties on what we call platforms. So one of the most distinctive, of course, is USNS Mercy, pictured there in the upper right. That's a hospital ship that's capable of caring for 1,000 patients, has 12 operating rooms, can make its own oxygen, can land helicopters there on the top deck. And so that's one example of platforms. And so taking a look at how we operate around the world is a key priority. And you'll see we actually adjusted one of our platforms during the COVID response to be able to perform. And that leads me to performance. We prize high reliability. We prize the ability to be a learning organization. So certainly, where you are now in your career, certainly learning is the centerpiece of that. But it's an opportunity for me to tell you that learning should never stop. I am an avid reader, constantly trying to keep up with things both in and outside of medicine. And as I'll show you, we believe in rapid cycle feedback. We're not afraid to face the facts where we have a challenge and figure out how we can improve, because we're never content with our performance in Navy medicine. And all 3 of those things come together to produce medical power, as I'll show you. I mentioned our people. The list that you see there are those on active duty. But we also have civil service employees, doctors, nurses, technicians, and we also have, in some cases, we have contractors that work with us for us to do our mission. You'll see there for the 4,000 physicians, really almost every specialty is represented within Navy medicine. As you might imagine, we have a higher concentration of surgical and emergency medicine and anesthesia type folks because of our combat casualty care mission. But as you'll see during the portion of the talk about COVID, we have relied very heavily on our scientists, our public health specialists, our preventive medicine teams, and really they've been at the forefront during this response, and those of us in surgical fields have stood back and applauded their efforts while figuring out ways that we can adapt to support them. We also have a wide range of nurses, medical service corps personnel, so that includes our hospital administrators, but it also includes scientists, as well as clinicians such as optometrists, physicians assistants, those fields. So there are actually 31 different specialties within the medical service corps. And I mentioned our dental corps, really laser focused on readiness, because you can't deploy away on a ship for a long period of time and be effective if you're focused on dental pain or a dental issue. So our larger ships actually have dentists that go with our ships and with the Marine Corps. Whereas our smaller ships do not, but have access in a larger, what we call strike group. And then really one of our real keys to success are our corpsmen. These are enlisted members, so generally they come to us after high school, and they receive medical training. They are embedded with the platoons of Marines in all of the areas where they operate. We have independent duty corpsmen that have extra training that go aboard our smaller ships and are the primary medical support to those ships. And so a wide range of specialties there. And I'm proud to say that in many cases, we're able to provide additional training identify corpsmen with particular potential who ultimately become physicians and nurses and medical service corps professionals. And then we have a number of non-medical support personnel who I mentioned, our hospital administrators, our environmental health officers, those sorts of folks. And I mentioned our platforms, and fundamentally our hospitals are much more than a hospital as you might imagine. They're also the area where, you know, all of our folks are getting daily training while providing care to our dependents. So you may be surprised in my biography that I was a pediatric orthopedist by training. Well, in fact, you know, I took care of and had great pride in taking care of the family members, children of our service members, but was also a faculty member in our residency program at Naval Medical Center San Diego, training our future residents. So we are, that is a great opportunity for me to share that we are actively engaged in graduate medical education at all levels, nurses, corpsmen, and doctors, and have a wide range of residencies available. For those things where we can't support a residency, but we need that field, we actually arrange for what we call out-service rotations, both for residency and for fellowship. Mentioned our research labs. We have a network of research labs around the world, and they're actively engaged in, as you'd imagine, infectious disease and emerging disease research. And we're really at the forefront of the response a few years ago to Ebola in Africa. Public health teams, those we actually have those aboard our aircraft carriers and our large amphibious ships right now, who are helping protect those crews, as are our preventive medicine teams. And we actually, I think of them as our offensive linemen. Every day they're doing the hard work of protecting our folks, what we call force health protection. And they don't get a lot of recognition for it, but they certainly deserve it. In the 8 months that I was in Iraq, the forward operating base that we were on had no disease outbreak the entire 8 months, despite large numbers of people coming and going. So that's a real tribute to what they bring to Navy medicine. I mentioned our hospital ships. I'll talk a little bit more about our expeditionary medical facilities, which are essentially field hospitals, a little bit later in the talk. We also have teams, what we call sprint teams, that can go, that can respond in the event of an aftermath of a tragedy, for example, to provide additional behavioral health and support to the teams affected. And so we for example, sent teams out to the destroyers in the Pacific that were involved in the collisions a few years ago, and maintained very close psychological support for those crews. I mentioned our medical corps. We have surgical battalions that you know are integrated within the Marine Corps, and they go out and in fact, I was attached to one when I was in Iraq. And then all of our ships, as I mentioned, our larger ships have doctors and in some cases surgeons on our aircraft carriers and amphibious ships. And our submarines used to have doctors aboard, but now we have independent duty corpsmen, but they have direct access to physicians should they need that support. And then we have a couple of other very special areas. If you're interested in aviation medicine, we have flight surgeons who actually do, in many cases, get to learn how to fly as part of that. But at the very least are part of a aviation squadron and get plenty of time as passengers in our tactical aircraft. And then I had the opportunity as a diving and undersea medical officer supporting a special warfare unit. It was a training unit down in Puerto Rico, and would go aboard submarines for about 10 days at a time to be there to provide any medical support necessary during those training evolutions. So hopefully you can see there's a broad range of ways that or platforms that we operate on to do what we need to do to support the fleet and the Marine Corps. And again, for performance, foundational, of course, is our residency and our medical training. but then we build on that. And so because there are many different skills that you need to be able to do kind of some of the unique missions that we do. So we often practice in very austere locations. The tent hospital that I was part of in Iraq was only 45 people, but treating, as you'd imagine, very severe trauma. And so there are ways that we have learned how to do that. And so we make sure that all of our folks who go forward receive that training. So if you've got the spirit of adventure and you want to challenge yourself as a medical provider, I can guarantee that the Navy will give you that opportunity. But we are, as I mentioned, a learning organization. We fundamentally believe in the principles of high reliability because that's fundamental to the fact that we're always adapting. We always have to be agile. And so being a learning organization, responding with rapid cycle feedback to the events in which we find ourselves is fundamental. So if you take all three of those things, you get the power of Navy medicine. And in this case, I'll walk through how we were able to do that for the COVID response. Like all of you, we were surprised by, this adversary. Certainly we're aware of what was going on in China, and we're formulating how we would respond. But frankly, initially, we didn't understand some of the key characteristics that have made COVID such a formidable adversary, such as asymptomatic transmission. And so, we immediately got our researchers engaged. Our public health folks were actually aboard the Theodore Roosevelt, and so we're able to provide some very valuable initial information. And then I think, as you know, we're engaged in what we call a defense support of civilian authority operations, where we provided military medical support to the United States, which was not unprecedented, certainly for a pandemic. It's highly unique. We have responded in times of disaster response and those sorts of things, but in this case, actually going and working within civilian hospitals, arm in arm with civilian providers, such as we did in New York and Baton Rouge and Dallas and other areas, was kind of a new wrinkle for us. But we were very, very pleased that we could step up and help take care of our fellow Americans. And so I'll kind of go through these a little more detail. So the initial response, obviously, was getting information out to the fleet, the Marine Corps. What's the nature of this virus? How do you protect yourself against it? In the middle there, you can see that this was one of many videotapes that I made that went out to the fleet, with kind of the latest information about coronavirus. You can tell that one was early on because we were still calling it novel coronavirus before we came up with the COVID-19. But participated in several, press conferences at the Pentagon. The gentleman there next to me is General Ron Place, who is the director of the Defense Health Agency that we work with in coordination for providing the health care that we do. So very much early on, informational, trying to get ahead of understanding the behavior of the virus, and help figure out a way that we could continue to operate as a Navy and a Marine Corps. There were initial calls, believe it or not, just, hey, why don't you just pull all the ships back in, stay safe. But frankly, that's not what the United States Navy does in our role of protecting the country, keeping trade routes open, for example. And so we did not have that luxury. And so we had to work through producing the medical guidance so that we could operate in that contaminated environment. And as I said, our scientists and our public health experts have come up huge for us. We have a Navy Marine Corps Public Health Center that's a mecca for people who understand the fundamentals of epidemiology and public health fundamentals. And so we've leaned on them in a big way to help us formulate guidance, and guidance specific to having to live aboard an aircraft carrier, as you see there, or even more challenging on a submarine. And we don't do this in isolation. we have been very fortunate to have an ongoing relationship with the CDC prior to COVID. And we actually have one of our preventive medicine officers stationed in Atlanta at the CDC. And so they were able to help us do an outbreak investigation early on the Roosevelt. And that was published in their publication, the MMWR, Mortality and Morbidity Weekly Report. And that was one of the first reports, actually, that identified loss of taste and smell, for example, as early indicators and kind of a typical presentation of the virus, as well as some early understanding about the antibody response and what percentage of folks developed what are known as neutralizing antibodies. And so clearly on the forefront. And I will tell you that we've done a prospective study with Marine recruits down at Parris Island in South Carolina. And the results of that and understanding kind of the initial antibody response will be published soon in a prestigious journal. So we believe that we have this incredibly important mission of force health protection, but also that we have a duty to share what we've learned with the nation at large. And so that's just an example. And in fact, we get a little press doing that. The bottom picture there is one of our investigators for that study at Parris Island, known as the CHARM study, actually being interviewed on, I think that was CBS this morning. So if you have an interest in disease research, tropical disease, infectious disease, we definitely have an abundance of opportunity in Navy medicine for you. Or if you're interested in the blocking and tackling of public health and social distancing and how to protect people at risk, again, that's a growth industry for us, as it is, of course, around the United States and the world. I mentioned the deployments. So that defense supports the civilian authorities. It's very clear we have to be asked formally to do this, but we are always ready to do so. And so famously, you know that the USNS Comfort deployed to New York, and the initial mission was envisioned to be that we would unload trauma and other non-COVID related conditions from New York hospitals so that they could focus on COVID patients. But the sheer number of cases there mandated that we adjust on the fly. And so we took a ship that's designed for combat casualty care and converted it and set it into, capable of handling isolation. I will say that there's no shortage of ICU capability aboard Comfort and Mercy, and they have more than 50 ICU beds, all with ventilators. So those came in very handy. I promised you I'd tell you about the expeditionary medical facilities. Those are field hospitals primarily designed to support the Marines in the field with casualty care. We essentially stripped off the surgical part of those, bolstered the critical care nurses and doctors and corpsmen, and then sent them without their equipment to civilian hospitals, as I mentioned, in other places outside of New York. As I mentioned, primarily in the South. And we learned a lot from that. And I'm going to tell you how we adapted kind of in the second wave of deployments. We also sent some individuals, primarily reservists, that went to 7 hospitals in New York and embedded directly with those hospitals. And I think you'll hear one of the silver linings of the COVID response, I think, is it's really accelerated our use of telemedicine. We had a very good foundation of telecritical care, but now we've done quite a bit more virtual health, particularly in mental health and others, so that we can continue to treat our patients yet not expose them unnecessarily to having to come into the hospital for those appointments. And then we are proud to say, and largely because we staffed each hospital ship to care for up to 1,000 patients. So that was about 2,000 staff to do that, almost a 1-to-1 ratio. Early on in the response for COVID, of all the military response, Navy medicine actually was responsible for about 70%. And we were proud to do it. And then we had some other interesting responses. So USS Kidd is one of our destroyers. So I told you they have independent duty corpsmen, and they had an outbreak early on. And so we were able to put together a 7-person medical team very quickly and fly them down to just off the coast of El Salvador, where Kidd was performing counter-narcotic operations. And we learned quite a bit from that, and we actually studied all of those patients when the ship came to San Diego. Our researchers were there at the pier to assist in greeting them, and were able to draw blood and get nasal samples and gather some very valuable information again about the initial antibody and immune response. So I mentioned that our expeditionary medical facility. So that second way, we recognize that in order to be most effective to assist FEMA, the Federal Emergency Management Agency, that we adapted our medical capabilities to platforms that they recognize. So one of which they call the acute care team, which is 44 people. It's critical care heavy in the sense of critical care doctors, nurses, and corpsmen. And then we also put together 4 what are known as rural rapid response teams. So there's 7 people, again, 1 critical care doc, 5 critical care nurses, and a respiratory technician. And we responded to hospitals in Southwest Texas that were overwhelmed, did not have the ability to transfer the patients they had because their typical transfers were to hospitals already saturated. And so we essentially helped them set up critical care units there, take care of the patients on site. And this was a true win-win. Not only were we able to come to their assistance and to care for fellow Americans, but we learned some valuable lessons about adapting our EMFs, or expeditionary medical facilities, to future missions that we'll have to do overseas. A big part of what we do is, as I mentioned, is to provide guidance and continually updating guidance to the fleet as to how to deal with COVID. I think you all remember that early on, mask wear really wasn't deemed that important, wasn't felt to be effective. As the evidence came out that it in fact was, we made sure that the fleet knew that, and we were providing the guidance as to how to do that correctly. And I mentioned rapid cycle feedback. So we are currently on our 3rd major revision of our standard operating guidance for the fleet, and we continue to adjust based on new knowledge of the virus. And then we have specialized populations, as you might imagine: pilots, those who serve on submarines, those who serve doing firefighting and other specialized tasks. And as we've learned about the clinical manifestations of COVID, we know that it can affect, of course, the lungs, but also the heart. And so we want to make sure, and we've developed screening guidelines for any aviator, for example, or submariner or diver who is infected. We've got a process to clear them to know that they can safely operate their high-speed jets and submarines and such. So that's probably a unique area. Obviously the FAA is interested in that. We have shared what we've learned with the FAA, and again, trying to be a good steward, of the resources that we have to make sure that we're sharing what we learn. But in many cases, there isn't a civilian submarine agency that I'm aware of. And so in some cases, there's work that we do that really is unique to our environment. And as a submarine medical officer, I can tell you that's fascinating. The physiology of diving, recompression therapy, all of that is truly a great way to expand what you've learned from your physiology classes, for example, and to be able to have practical tools at your disposal. So yet another opportunity you may not find anywhere else but in Navy medicine. So hopefully I've made it clear that we are a very holistic organization. Although you might think of us as primarily providing combat casualty care, that's just one aspect of what we do, and it takes a village, if you will, to be able to do that, all the way from our researchers, those who those who helped me, develop policy for how we're going to provide medical care in those specialized environments in which we work. Our public health folks knocking it out of the park in terms of protecting, providing guidance and doing the necessary surveillance to protect our folks, and our dentists up there you can see in the upper left. Really, soup to nuts. If there's almost can accommodate just about every medical specialty within Navy medicine, as well as dental. I think we have 13 different types of dentists as well. So, and frankly, all of my dental care my entire life has been by the Navy. I was a Navy dependent. My father was a Navy doctor, and they do a terrific job, just as one example. Okay, so that's essentially my spiel. Outstanding, well-trained people who we train with specific skills over and above their medical skills to function in the environments in which we place them, operating on, high precision platforms, special platforms, as you can see, USNS Mercy there, operating using high performance principles to produce that medical power that our warfighters need to protect our country. And I'm going to let you in on a little secret that I don't think even many in Navy medicine know, but the way that you tell mercy and comfort apart is, I knew this was mercy immediately, not from the geography, but because the red cross there, the vertical red cross that you see is slightly off center, whereas comfort, it's on the center line of the ship. So there you go. You can, that's a great trivia bet that you can win with your friends. So with that, I'd love to open to questions and hear what's on your mind.
Oh, that's great. Thank you very much. Was that intentional to have the Red Cross set off center, or a mistake?
No, actually, it helped. So during the original Gulf War, helicopters would be able to tell mercy from comfort from the air.
Oh, got it.
Yeah.
Got it.
So there was a basis for it, rather than somebody having a bad day with this.
Yeah. Good to know. Okay. While we're waiting for some of the students, I think if it's okay with you, if we allow people to take their, open up their mics, they can ask their questions. But I was wondering if you could tell me a little bit more about the relationship between FEMA and the Navy response to COVID. Is that something that FEMA needs to request?
Yes, so we stand by, so that Defense Supported Civilian Authority request, there's a formal process that Health and Human Services, or in this case, Department of Homeland Security can make, and then it's determined what capabilities are needed, and then we adjust. So initially they asked for our expeditionary medical facilities, but what they really needed was what we came up with, which were just the small medical teams.
Right. And are they still being deployed, the medical teams around the country as the incident continues to increase?
We don't currently have any in civilian hospitals right now, but we have some that are on what are known as prepared to deploy orders.
Okay.
So that they're ready to go. And unfortunately, as we're seeing kind of an increase in cases, right, I can foresee that we will need to do that again. A true privilege to be in a position to do that. And I was, I pinch myself every day I wake up to say that I'm in the position I am to lead this amazing group. And I would just say to the group, best of luck in your pursuit of a medical career, no matter where you end up. If you end up in the Army, I'm going to be rooting against you at the Army-Navy game, but just fair warning.
Oh, wait a minute. Wait a minute. I happen to have my Army-Navy.
Go Navy. All right. Beat Army.
I'm ready to go.
Excellent. Great. Okay. Well, thank you for that. But best wishes. And I would just say that wherever you end up in a medical career, I know that you'll find it to be very fulfilling. It's a lot of work, no question there, as you all know. but I, I'm a huge believer. The effort that you put in will be more than rewarded by the experiences that you'll have. So best of luck, and if we in Navy Medicine can help you reach your goals, we're here for you.
Thank you very much.
Out here.
Thanks,
Thank you.
Pleasure.